Welcome to the Avian necropsy examination. This video series was developed by veterinarians at Cornell University College of Veterinary Medicine and the United States Department of Agriculture. There are many methods for performing a necropsy examination in poultry. For educational purposes, we will demonstrate a comprehensive examination. With experience, you will soon develop the skills and judgment necessary to perform an efficient necropsy exam in the field, adapting techniques that work well for you. To perform a post-mortem examination in birds, you will need the appropriate attire. Waterproof disposable or washable coveralls, rubber boots or foot covers, and an apron are worn to protect the examiner during the exam. Disposable heavy-duty gloves are also required. Additionally, safety glasses and a face mask can be worn to protect the face from liquid splashback. Wearing the proper attire during the necropsy exam ensures personal safety and facilitates easy cleanup and disinfection following the procedure. When dealing with cases that may involve a zoonotic disease, you will need to take additional precautions to protect yourself. If highly pathogenic zoonotic diseases, such as avian influenza, are a concern, special personal protective equipment, known as PPE, should be used. This equipment includes a head cover and a respirator, worn to protect the examiner from airborne infectious pathogens. When handling these types of cases, it's important to work with the state or regional authorities who can provide appropriate protective equipment and diagnostic assistance. A variety of instruments can be used to perform the avian necropsy examination. Which instruments are used often varies according to the availability and the examiner's preference. Some useful instruments to assemble may include a scalpel and steel knife for cutting tissue, poultry shears, rongeurs or scissors for cutting bone, thumb forceps, and a variety of surgical scissors of various sizes for trimming small pieces of tissue. In larger species like the duck and turkey, you may wish to use sturdier tools like heavy-duty scissors and shears to help you cut through the thick bones and tissues. It's important to have several sterile sets of these instruments on hand during the necropsy examination. This will allow you to collect multiple sterile tissue samples for diagnostic testing. Before beginning the exam, you will need to gather a bucket and disinfectant solution. These will be used to wet the outside of the bird, to reduce the aerosolization of potential pathogens, and to keep the feathers out of the necropsy field. There are a variety of disinfectant solutions that are suitable for this purpose. However, it should be noted that the anionic detergents are superior to surfactants. For more information on selecting disinfectant solutions, consult the following reference, available online. You will also need to have routine cleaning supplies on hand for cleanup after the necropsy procedure. These include scrub brushes, detergent, and disinfectant solution. It's also a good idea to pre-assemble all the supplies required for diagnostic specimen collection before beginning the necropsy exam. Pre-assembled kits save time in the field, facilitate compliance with shipping regulations, and ensure the arrival of high-quality specimens at the diagnostic laboratory. Your kit should include an assortment of plastic jars with screw-top lids for histology samples fixed in formalin. Small plastic jars or tissue cassettes are recommended for transporting small tissue samples to prevent them from being lost. 10% neutral buffered formalin, an assortment of blood collection tubes, sterile culture swabs and transport tubes for collection and transport of aerobic, anaerobic, and mycoplasma samples, fecal cups, flat wooden sticks such as tongue depressors for submitting sections of skin, muscle, and nerve for histology, a small propane torch and metal spatula for searing tissues to collect aerobic and anaerobic bacteriology samples, a magnifying lens, post-mortem submission forms, and a pen and waterproof marker for labeling containers and filling out forms. These items are the minimum supplies required for necropsy and diagnostic sample collection. You may wish to personalize your diagnostic kit with other items. In an ideal situation, freshly deceased birds should be submitted immediately to a laboratory where a pathologist can perform a detailed post-mortem examination. If the post-mortem examination must be performed in the field, it's best to first remove the birds from the farm for the examination. This practice will help maintain biosecurity measures at the farm. In special emergencies, a brief necropsy exam can be performed on-site at the farm. In a farm setting, make certain that you select a location that has ready access to water. This will allow proper cleanup following the examination. Post-mortem examinations may be periodically performed on clinically healthy birds to facilitate disease surveillance in large poultry operations. Selecting the appropriate birds and the correct numbers of birds for this procedure is very important. A general rule of thumb is to examine at least 10 birds for every 20,000 healthy birds in the flock. It's important to get a random sampling of birds for surveillance purposes. Random sampling can be achieved by walking through the flock and choosing birds according to this diagram. If the flock has both male and female birds, be certain to include both in your sample. In a diseased flock, ideally 4 to 5 birds should be evaluated by post-mortem examination. In small flocks, you may need to examine fewer birds. It's best to select birds that are exhibiting abnormal behavior or clinical signs. If possible, avoid birds that are in excellent health or those that have been culled from the flock. When examining previously deceased birds, select individuals that have died recently. This will minimize the effects of tissue autolysis, which may interfere with diagnostic testing. Once you've selected the birds you will examine, be certain to adjust the farm's inventory records according to the number of birds you post. Following the post-mortem exam, proper cleaning, disinfection, and carcass disposal are critical to biosecurity and transboundary disease control schemes. The first step in cleanup is mechanical cleaning using detergent solutions, brushes, and hosing with water. Mechanical cleaning is crucial to removing dirt and organic material, which will allow detergents to destroy most of the infectious agents present. In the next phase of cleanup, disinfectants are used on equipment, boots, and contaminated work surfaces. There are a number of classes of disinfectants available, including oxidizing agents, phenols, quaternary ammonium compounds, halogens such as hypochlorites or bleach, and iodine and aldehydes like formalin. The efficacy of various disinfectants for the deactivation of infectious agents will vary, but the most important factor is to use the disinfectant after organic matter has been removed. For more information on selecting appropriate disinfectants, particularly in cases of suspected transboundary disease outbreaks, consult the following reference available online. There are a number of methods for disposing of the carcasses of birds, such as burial, incineration, rendering, composting, and alkaline hydrolysis. The method selected should take into consideration a number of variables, including but not limited to the volume of carcasses, size and type of birds, biosecurity requirements, and public and environmental health regulations. The overall objective is to economically dispose of the carcasses in a biosecure manner which protects animals, humans, and the environment. When dealing with transboundary diseases, carcass disposal techniques require special considerations. For more information on carcass disposal methods, consult the following reference, available online.